The liver is an amazing organ. It obviously plays a role in toxin and drug clearance. I think everybody knows that. But what is less known is that a lot of blood metabolism, a lot of the organ system of the blood actually depends on the liver, actually for direct production. So every clotting factor that's in the bloodstream is produced in the liver. And then certain synthetic stimulants, I think about the stimulus needed to produce platelets is actually sent from the liver to the bone marrow. And finally, the liver scavenges iron from dying, aging red blood cells to reuse to make new red blood cells. So oxygen, hemoglobin oxygenation and coagulation are both intimately dependent on a functioning liver. And as we'll get to, one of the signs that the liver isn't doing so well is when coagulation is impaired and you have an unexplained anemia. The liver also produces bile, which is essential for digestion. And really importantly, the liver converts unused glucose. So, you eat a big meal, your body says, hey, man, I only need like 20% of the glucose that was in that meal. The other 80% is converted to glycogen by the liver and stored in the liver. And then it can be reconverted back into glucose in times of when you're not feeding. So in between meals, or let's say you're a patient and you're NPO or you're not being fed, the liver is a rich synthetic source of glucose, which is of course essential for brain function, as well as a bunch of other bodily functions. And then I guess finally, one of the things that the liver does that's super important is it converts ammonia, which is very toxic, to urea for excretion. And if that doesn't happen, unchecked rising levels of ammonia can first cause confusion, then lethargy, then coma, and then cerebral edema and death. So one of the things in acute liver failure that's really severe that we check for is neurologic status. And if we don't have a good neurologic status, go to the CAT scan and look for signs of cerebral